orient you with the equipment and supplies needed to complete your simulation lab assessment. It's important that you demonstrate your skills or procedures using the equipment provided. All equipment needed can be found within your simulation room.
If you can't find something, ask the assessor. They'll either show you where it is in the room or tell you, please move on if it isn't available. Let's take a look at the mannequins first. Mannequins can be of any gender. Some of the mannequins you may see will breathe and blink. Other mannequins may just be very realistic dolls. The mannequins allow you to perform a wide range of nursing interventions. Let's start with assessment. Actors situated in the observation room talk through the mannequins so you can have a conversation.
Sometimes you might need to conduct an assessment that the mannequin cannot show. In these cases, the assessor will tell you the result of the assessment. In some scenarios, there may be some props that you will need to ignore. Any props you need to ignore will be taped with green painter's tape. Some mannequins have a lot of machinery in them, making them too heavy to lift. In this instance, we will have a no lift, no turn sign in the room, next to the clock. If you would like to conduct any nursing procedures on the back of a mannequin that has a no lift, no turn sign, assemble the supplies and equipment you would need, and just explain to the assessor what you would do once you have all the equipment in place.
Sometimes there will be actors in the room. Treat them in the same way you would treat a mannequin. The only difference is that you do not need to expose an actor's sensitive areas. Here are some important things to know about the setup of the room you will do the SLA in.
You won't find a sink in any of the rooms. Any water that you need for patient purposes will be provided to you in a basin or pitcher. Every room will have hand sanitizer and gloves for you to use. Remember to use them when necessary.
There is a date posted in every scenario room. That's the date you'll use for the scenario. Every room also has a clock showing you the time for your scenario. These clocks have been set specifically for each scenario. Refer to the clock as necessary for the administration of medicines or for documentation purposes. Also, depending on the scenario, the assessor may let you know that the time has changed.
Some scenarios will have a hospital bed in them. This is what they look like. To set the brakes on the bed, use the red and green foot pedal at the bottom of the bed. When the green side is pushed up, the brakes are off. When the red is pushed down, the brakes are on. To control the bed, use the panel on either side of the bed. These buttons will raise and lower the bed. These buttons will raise and lower the head of the bed. These buttons will raise and lower the feet of the bed. You may need to lift the side rails up and down. To lower the side rail, pull on this lever. The side rail will unlock and you can gently lower it down. To raise it, simply pull the side rail out and away from the bed, then up until you hear the click as it locks into place.
This is what the call bell looks like. They don't actually work or make a noise. The oxygen and suction are mounted on the wall. You will have oxygen delivery devices available in the room appropriate to your scope and the scenario. You will know what the flow is, as the ball will indicate the liters per minute. If your scenario requires you to change sheets, you'll find them on top of a bedside table or on a cart labeled linen cart. The sheets are clean.
In some stations, the medications for your patient may be in medication organizers or prescription containers. All the details you need will be printed on the label by the pharmacy.
Some scenarios will have food or pills for you to administer. Simply hold it up to the actor or mannequin's mouth. They will not eat the food or take the pills. When they say thanks, that means they have taken the food or the pill.
These are the models of Foley drainage bags and leg bags you may see in the rooms. This is how you open and drain them. Some rooms have graduated cylinders where they might be necessary.
These are the type of commodes or toilets you might see in the rooms. To set the brakes, do this. To release the brakes, do this.
You'll find bedpans in the bottom of the bedside cabinet. If you're at a station that has a mannequin with a no lift, no turn sign, and you need to use a bedpan, simply place the bedpan next to the mannequin. Orient it the same way you would in real life. Explain to the assessor what you would do next. The assessor will let you know. Please move on.
You may find walkers and canes like these ones inside the room to help with mobilizing the patient.
Although you may see different types of wheelchairs, they will all have brakes on the side. To release the brake, flip the lever. To set the brake, flip the lever the other way. Here's how you remove the leg rests. If you need a transfer belt, you will usually find one close by. It may be hanging off of a bed, a chair, a wheelchair, or the walker.
The rooms may have a phone in them. If you'd like to use the phone to call someone, like a case manager, a physician, or another nurse, simply pick up the phone and state who you would like to speak with and leave them a message. There won't be anyone on the line. Your assessor may simply say, "Noted, please move on," or may tell you what the other individual would say.